Next up, we're going to hear from Veena Muktali, who is presenting SmartScope CX.
Good afternoon, everyone. My name is Veena. The story of the SmartScope CX began when I and my co-founder Kaustubh met a cervical cancer patient back in 2014. This lady was fighting for her life, despite the disease being easily curable if it were found in its early stages. And we learned that every 2 minutes, one woman dies somewhere in the world because of cervical cancer. 70% of world's women, adult women, don't have access to easy gynecology tests in their neighborhoods. That prevents them from undergoing cervical cancer screening, which is necessary to prevent 350,000 deaths that happen in the world. I'm sorry about that. I'm a little nervous. I should have switched this on. Yeah, all right. So as you can see, the darker colors in the picture show that there are low and middle income countries that suffer the most from this, but no country is actually devoid of cervical cancer deaths. Very soon, we decided to use our engineering skills and knowledge of technology to build a handheld, easy-to-use device called the SmartScope, which is a gynecological camera, which is enabled by AI, which analyzes the images captured by the camera and provides a multi-level risk stratification within 30 to 40 seconds. So this will enable healthcare workers or nurse midwives to conduct screenings in their communities with 90% average accuracy and providing a single visit point of care test to these women. We were happy to see this technology taking its wings and going to the far corners of India within a few years. And since commercializing this in 2019, now we have many patents granted, we have many publications published, and we've also gotten regulatory approvals, including in India and the US FDA as well. Now we are taking this to many other low and middle income countries, including a few in Africa, Latin America, and Southeast Asia. Since its inception, we have about 1,000 user sites who have screened more than 350,000 women for cervical cancer, and out of those, 6,000 plus women have been already referred for treatment, and these are lives saved, I'm happy to say. We have a great team of clinicians who we have worked very closely with. They have not only co-developed the solution with us, but they have also helped us test it in various segments in and around India. And along with them, we also have a team of 60 people who come from a diverse background from engineering, data science, clinical know-how, as well as public healthcare economics. And of course, our biggest strength is our partners. So a wise man said that if you walk alone, you can walk fast, but if you want to walk far, you have to walk together. So our more than 30 partners, in fact, and funders, supporters have taken us this far, and they are our greatest strength. And of course, we love to immerse ourselves in our users' environments with their help. So our first key ask is to help us with market access to Africa, Southeast Asia, and Latin America, because policy acceptance, marketing strategies, as well as funding for these projects is what will help us take the SmartScope to these women who deserve the test. Our second ask is connect with med schools and hospital chains in the US so that we can help create studies that will help us build a global standard. And of course, our third request for all of you is to also help us connect with funders of any type so that we can fund these projects and help take the SmartScope to many communities around the world. Thank you so much.